punches. So I guess, yeah, like, I don't want to just start off by asking, like, tell me about the company culture. First of all, I think I just gathered a lot of info based on what you just described
Yeah,
around like how the clinics are different. But maybe we start with like the story and like how this
yeah,
company is
yeah.
founded and where it is today and kind of where it's going.
Yeah, so okay, what I usually do is I have a kind of a script, although it's pretty free flowing. So I'm happy to kind of walk you through. You
Yeah.
tell me if we're getting too deep or not. But typically that's what I do. So I usually start out by just outlining a little bit about me, primarily because I am the one who runs the company. I'm not the I have staff that do the day-to-day stuff, but my background is all in healthcare. I wanted to be a pediatrician, but I didn't realize that my family was poor until the time I got ready to go to college. And so being a physician was not in my future. So I actually put myself through college, got my degree in business administration with a minor in HR and finance, and went to work for Sutter, which is the second largest healthcare provider in Northern California. And I had planned on staying in the long-term care world. I literally started out in working. I was responsible for skilled nursing facilities and for skilled nursing facilities and for Alzheimer's units, long-term and short-term acute care rehab facilities, and so on. And about halfway through my tenure, I was there from 89 to 97. So about halfway through my tenure, I got the opportunity to work in a staff model HMO called PACE, Program of All-Inclusive Care for the Elderly. Absolutely loved everything I did. We had a multidisciplinary team. We had everything from physicians, nurse practitioners, PAs, audiologists, optometrists, podiatrists, dentists, every spectrum of healthcare. We had social workers, we had PTs and OTs, speech therapists, and so on. We had our own adult day healthcare facility. We had our own transportation department. We did home health. We did home health, both from the nursing and from the aid side. And so our whole program was built around trying to keep frail elderly people out of a nursing home setting. So if they ended up in a nursing home, we had to pay for it. If they ended up in an assisted living facility, we had to pay for it. And we were capitated by Medicare and Medicaid to do that. And
Right.
so I learned a lot about the dynamics of team and how to manage complicated cases. These people are super complicated. So we learned stuff like, and I worked with our physicians on, do we leave somebody in the hospital over a weekend? No. Our people are frail, and our MDs either doing clinical rotations or we're just charging before Friday because stupid stuff happens over the weekends for these people, and so on and so on. So my point is, I fell in love with that model. I ended up doing a lot of lobbying in Washington, was involved in a lot of the developmental stuff for the National PACE Association and so on. And so I inadvertently fell into physical therapy, and I was trying to figure out how to cut our workers' comp costs. And we had home health nurses, home health aides, we had trained drivers, dietary staff. People were getting hurt with, constantly getting hurt. And so what we were attempting to do was to find a way to decrease our workers' comp costs. So I went to one of the things I did was I went to my PT and OT department and said, help me figure out how to put a return to work program together when somebody gets injured. And lo and behold, it worked. And so one day I realized, why are we not doing this before we even hire people? So then we started doing it when we hired them. Well, what I didn't realize is I was really creating like a work conditioning type program, which can be very typical if you do a lot of workers' comp and PT, but we were doing it at an employer level. And so we cut our workers' comp costs down. In 3.5 years, I cut our workers' comp costs down 75%. It was a pretty incredible thing. So my boss came to me, wanted to know what happened, how I did it all. And in the middle of all of that, Select Medical bought NovaCare back in the early 2000s, roughly between 99 and 2001. And so they were trying to integrate NovaCare into the Select Medical system. And so I was hired to be a controller over their West region market, and quickly ended up taking on Southwest, ended up taking on Midwest, and geographically, I oversaw half the country. And then ultimately, I ended up taking over their operations for the West and Southwest markets. They fired 2 of the PTs, put me in that role, and I got along incredibly well with the clinicians. And so I ended up running the West and Southwest markets, both operationally and financially, and then ran the Midwest markets financially. So long story short, Select Medical decided to spin off these clinics. And so I'd been in front of a bunch of different private equity groups, VC-backed groups, and all that type of stuff, and finally decided that I might as well just raise the capital and spin the company off. And so in late 2006, I bought the clinics from Select Medical. Now, little did I know that Select Medical was going to buy Health South's outpatient division and compete for head to head with me in every market that I was in.
Right.
So, competing with my old former employer almost immediately, which was, I look back now and it was pretty funny, but it was a great experience for me. But had I known what I know today, I may have never done it actually, because I probably would have been too scared to do it. The economy crashed right after we closed escrow, in late 06. Well, by 08, 09, the economy was in the trash. And so I had went from I don't know how many clinics I had to close. I had to close a whole bunch of clinics. We had to figure out how to survive. We had to figure out what it took to make a company survive during that period of time. And so we went through all kinds of fun things. One thing we realized is we got to wipe out debt. So we wiped out debt. I sat down with my team. We figured out a plan and we worked on that plan. And by 2015, we wiped out all the debt in the organization. We don't carry debt
Nice.
anymore. And so being debt free is what saved us during COVID and
Mhm.
some of the other things that have been going on over the years. And so that was one of the lessons I learned. Second lesson I learned is to diversify. And so we have 3 separate divisions. You'll probably never work with one of them, but it shows our creativity. We put together a network of physical therapy clinics. Some of them are mine, some of them are hospital systems, some of them are private practices. And we have roughly 125 to 130 clinics in Northern California. And I work with 3 independent physician associations that started their own HMO. And
Yeah.
so we provide physical therapy for their patients. So there's about 500,000 lives that are covered in Northern California. So if anybody in that HMO needs PT, they have to go to one of the clinics that's contracted with me. And so that's a super interesting. We do all the credentialing. We do all of the claims processing for the IPAs. We do all the reporting for the home plans like Aetna, Cigna, and stuff like that for them. We run their Medicaid program for them. So essentially all the MDs write us a check each month, and then we pay all the claims, we do everything. So that's one component of what we do.
Yeah.
Second component is our on-site division, and we have several large clients, and then we have a bunch of smaller clients too.